Thank you. It's an honor to be here with you. I think there's an important struggle going on, and we're faced with a very important choice, which is whether to further criminalize mental illness and put people with mental illness in jail, more people, or to provide adequate services which would tend to reduce the number of people with serious mental illness and reduce their disabilities. We have a crisis going on in the country. I'm a psychiatrist. I work in community mental health, and I testify as an expert in class action lawsuits about jails and prisons. The conditions and how conditions make mental illness worse, for instance, crowding, solitary confinement, which is very prevalent in the jails. We have a crisis. We have, I would say, over 2.5 million people right now in jail and prison. The statistics usually don't include immigrants, and we have millions of immigrants who are locked up or just surveilled in one way or another. But officially, there's between 2 million and 2.5 million people in jail and prison. That number is 7 or 10 times what it was in the 1970s. And while the number of people in jail and prison has been growing geometrically, the proportion with serious mental illness has actually been enlarging. So we've essentially transferred people. First we deinstitutionalized them and moved them out of the mental hospitals. The idea of that was to put community services in place in the community and treat them and do rehabilitation. The funding for those community services, as you know, has been incrementally cut. So there's very poor public mental health in spite of a lot of dedicated people trying to provide services. And people with mental illness disproportionately, first of all, there's substance abuse, and they wind up in jail and prison, where it doesn't go so well. A recent study says that concludes that there are 10 times as many people with serious mental illness in our jails and prisons as in our hospitals. So instead of going to psychiatric hospitals, people are going to jail and prison for all kinds of reasons. Some of them valid, some of them pretty bunk. Of course, this is all about race. Our Attorney General is saying that, first of all, he wants to lock up millions of immigrants. Second of all, he wants to revitalize the war on drugs and do minimal mandatory sentencing and make that much harsher. Now, what color people are going to be mostly affected by those policies? I mean, it's just a way to lock up people of color, and that exactly is the plan. It's no longer, after the civil rights movement, respectable to talk in a bigoted way about people of color and different races. And so instead, the language has been transformed into criminality. So we have the image of the young criminal, which of course is a person of color. There are 50% African Americans in our jails and prisons. How did that happen? There's something going on here that reflects a kind of racism in the society. And nobody says we're locking this person up because of the color of their skin. They say they committed a crime. But when white middle-class people commit the same or worse crimes, they don't get locked up. So we have racism up and down the entire spectrum of criminal justice proceedings and services. And lo and behold, 50% of prisoners are African American. Michelle Alexander outlines that, by the way, in her book, which I recommend, The New Jim Crow. Jail is no place for people with mental illness. The situation is very stressful, and there are very few programs. The idea used to be that people go to jail awaiting trial, so that's a short time, and then they serve up to a year if they're convicted in a jail. If it's longer, or if they're convicted of a felony, they go to a state prison, where there are more services. That's actually not the situation today. People spend many years in jail, and the jails are massively overcrowded. They're run as a culture of punishment. There are rules, and you get punished for not following the rules. The mental health care is minimal. In most jails, including Contra Costa, there's an attempt to prevent suicide, and there's cases that require sheriffs to do something about the very high suicide rate in jail. And when someone has an acute acute psychotic episode, there's usually services available. There are often medications available, psychiatric medications, and there's very little else. There's very little treatment of any kind, and people just have to survive. People with mental illness get in trouble everywhere. They get in trouble in the general jail population because they get beat up, they get victimized, or their temper's out of control and they get into fights that they started, but still it's an unfortunate development. Then they get sent to the hole, to segregation, to solitary confinement. And that's an area that I've become an expert on because in the prisons around the country, more and more people are put in supermax facilities like Pelican Bay. And I testify in trials about that, so I go in and talk to people and I try to understand what the damage is of solitary confinement. The mental health staff try, but they're too thin to really provide mental health services. Since we've got such a large proportion of prisoners with mental illness, the budget for mental health, everybody thinks that people go to jail or prison, they get the mental health services they need. Actually, if you look at the budgets for corrections around the country, corrections tends to get a huge proportion of the public funds. But the mental health program inside the budget for corrections tends not to grow and tends to be inadequate, so there are inadequate services. I want to take as an example schizophrenia and take as sort of an average case. Now, this is the dynamics I'm going to describe are true with all kinds of mental illness, but I want to use schizophrenia as an example. Schizophrenia is a condition that sort of the course waxes and wanes. People have psychotic episodes, we call them breakdowns, or in psychiatry called decompensations. They hallucinate, they're paranoid, they have disordered thinking, they do bizarre things, they don't know what they're doing. And we give them strong medications and we try to settle them down, we put them in a psychiatric hospital. And then the episode ends and they're in what we call remission. And what we try to do in the community, at least, is we put them in services so they'll learn some meaningful work. We try to help them with their social skills. We try to teach them the skills of daily living. And then in all too many cases, they're going to have another breakdown. It's the nature of the illness. And it doesn't mean they haven't gotten good treatment, just the people with this illness tends to have repeated breakdowns over a period of time. Now there's a large research literature about what happens to people with this diagnosis. And here's how the literature goes. The more completely they go into remission, that is when we medicate and treat them, if they become stable, and the longer time between episodes, the better their prognosis, the less disability they have, and the more quality life they're going to have. On the other hand, if between episodes they are traumatized, they are, for instance, homeless, they're beaten up, raped, they get into trouble, they're arrested, or, and this all combined, they do illicit substances, then what happens is their mental illness gets flared up in between the actual breakdowns. And then all the literature says that, all the research has found, that their prognosis and their disability are much worse. So if you take someone with this condition, and for instance, after they get out of the hospital, you put them in a halfway house, you involve their family in their treatment, you help them to actually take the medication they're supposed to take and learn a trade and that kind of thing, they do extremely well and they can have a very high quality life. If instead they're homeless, they're beaten, raped, and they're arrested, their prognosis and their disability are going to be very poor. And they're going to have, for instance, their episodes are going to become more frequent and not clear up as well or as fast. Now let's move to the jail situation. There are 10 times as many people with mental illness, including schizophrenia, in the jails and prisons. So let's take someone who, during a psychotic episode, breaks a law and gets arrested and sent to jail. The race matters again a lot because there's some discretion involved. Officers can take someone who is both mentally ill and breaking the law, either to a hospital for a 5150 involuntary commitment, or to a jail. And guess what the literature shows? If the person is white, particularly if they're middle class, they go to the hospital. If they're a person of color, particularly low income, they go to jail. And discrimination continues throughout the system. Now, what happens to them in jail is that they get inadequate treatment on average. And I'm not condemning the work of the mental health staff. They cannot get to people and provide them the care they need. They tend to put out fires. They tend to work with people who are suicidal or in a psychotic episode. They cannot provide the kind of intensive therapeutic work that's required to help people get their lives together. So their conditions worsens in jail. People with mental illness need to be in a treatment setting, and jail is not a treatment setting. Two of the worst problems in jails around the country, and you have this in Martinez at the detention facility, are crowding. The jails are massively overcrowded, so that a cell built for 2 will hold 4 people. The dormitories will have hundreds of people in them. There will be very little supervision because the staff is too thin. There will be fights, there will be rapes, and very little in the way of meaningful programs. This is not a setting for someone with a mental illness. They need to be in a treatment setting where they're supervised and helped to do the kinds of activities that are going to make their condition better. So if you put them in jail, they're going to suffer. Now, the other thing that happens in jail, and I go around the country looking at jails because there's pending litigation, and I talk to a lot of jail commanders and a lot of sheriffs and a lot of deputies, and I say, what do you do with someone who has serious mental illness? Universally, they say, we put them in a cell by themselves. Why do you do that? Because they have trouble out in the day room. People victimize them, and it's just less of a hassle for us if we put them in a cell by themselves. Well, let's think about that for a minute. In a psychiatric hospital, when you have a patient who wants to stay alone in their room, the nursing staff or the social worker go in and talk to them and say, hey, you need to come out and be in the milieu, you need to come to the group. And the reason is because, for instance, depression involves isolation. People who are depressed isolate themselves. So if you want to treat them and help them get over their depression, you want to socialize them, even if they don't feel like it. You want to do it in a friendly way. I wouldn't use force to socialize someone. But you want to encourage them, come on out of your room, or you lock the door to their room. So they have to be on the unit, and then you go over and coach them. You say, why don't you talk to Joe over there? I think you two have some things in common. And you teach them social skills. All right, in jail, the opposite happens. The more seriously disturbed someone is, the more time they're going to spend alone in their cell doing nothing because there's nothing to do. The sheriff is happy because he doesn't know what to do with someone with mental illness. If he's alone in his cell, there's no trouble in the jail. But that person's mental illness is getting worse, his disability is getting worse, etc. I see this in solitary confinement around the country. That's what I testify about most. That solitary confinement is just toxic for people with mental illness. Yet in jail, and we don't call it solitary confinement, we just call it management. That is, we put them in a cell by themselves and leave them there. And they can spend years in that jail. And their condition is going to get worse. The prognosis is going to get worse. Let's talk about the alternatives. Most people are in jail because they can't afford bail. The overwhelming majority. The only difference between them and the people who are out in the community, for instance, awaiting trial, is they're more poor. They're lower income. They can't afford bail. There's no reason to have an institution that makes people's mental illness worse simply because they're poor. And that's the main reason. Another reason is immigration. Your sheriff happens to cooperate with ICE. There's no reason for jails to cooperate with ICE. ICE is locking up millions of people around the country in very bad detention centers. I've toured some of them in litigation. They then, when those detention centers get overcrowded, they demand that the states and the counties take their detainees and hold them for them. So what they're doing is crowding our jails. Or there are state prisoners being sent to the local jails. There's 3 groups. The pretrial people who can't afford bail, that's the biggest group, by the way. The immigration holds and the state referrals. Those people could all be released from jail. What we need is treatment in the community. The research literature is this. People with mental illness who go to jail have worse mental illness when they get out. or prison. People who get treatment in the community do very well relatively. So what we need is treatment in the community. I have read some arguments about your current predicament in Contra Costa County. I'm in Alameda County. But that the jail in Martinez is horrible, overcrowded, people are persecuted and abused, etc. And that's why we need a mental health jail in West County. First of all, there's no such thing as a mental health jail. As you read the sheriff's proposal, you will find that very little of it has to do with mental health treatment. Most of the beds are going to be used for something else. And I promise you that in successive years, the budget will be cut for the mental health care, and you'll just be warehousing people in the jail. But second of all, what needs to happen, because the Martinez jail is so overpopulated, is there needs to be diversion. There are various ways to do diversion. There's drug courts, that is, the research shows that people with a substance abuse problem who go to jail or prison come out of jail or prison with a substance abuse problem. In contrast, people who are treated in the community in a recovery program and complete the program, 80% of them are going to be clean and sober after 3 years. So it's a no-brainer. They should be given recovery services in the community. You need courts to do that. You have a drug court in Contra Costa County. You don't have a behavioral health or mental health court. You need one. Diversion is the answer. It isn't that we should build more jail beds in West County because Martinez is disgustingly overcrowded. It's that we should develop the services in the community so people can be diverted from jail and that way get actual treatment, either substance abuse or mental health treatment in the community, rather than have their condition made worse. I think I'll stop there.